Minor and transient Moderna COVID-19 side effects found in large U.S. study. The COVID-19 Moderna vaccinations are relatively safe, with most reported side effects being minor and short-lived, according to research from the FDA and the CDC. According to a new study published on medRxiv, over 298 million Moderna COVID-19 vaccinations were given in the first 6 months of the U.S. vaccination campaign. There have been some reports of major side effects with Moderna vaccines, but they are extremely unusual. By age group, vaccine-related mortality were fewer than projected. Vaccines are still the best defense against COVID-19 infection, say experts. COVID-19 vaccine safety data came from the U.S. government's Vaccine Adverse Event Reporting System, VAERS. Unverified complaints of illness or health concerns associated with vaccination can be submitted voluntarily to this database. From December 14, 2020 to June 14, 2021, the U.S. administered 298,792, 852 Moderna COVID-19 vaccination doses. The Pfizer-BioNTech vaccine had 167,177,332 and the Moderna vaccine had 131,639,515. Females received more immunizations than males. The Pfizer-BioNTech dose had a median age of 50 years while the Moderna dose was 56. White non-Hispanics accounted for 38.4% of vaccination recipients. VAERS generated 340,522 reports. The Pfizer-BioNTech vaccine caused 164,669 side effects and the Moderna vaccine caused 175,816. 92.1% of COVID-19 vaccination side effects were mild. The most prevalent non-severe adverse effects were headache, 20.4%, fatigue, 16.6%, fever, 16.3%, chills, 15.7%, and pain, 15.7%, 15.2%. Approximately 6.6% of reported side effects were severe but not fatal. Vaccine-related deaths were documented in 1.3% of cases. Shortness of breath, 15.4%, death, 14.1%, high temperature, 11%, weariness, 9.7%, and headache, 9.7%, 9.5%. VAERS received 4,472 non-duplicate death reports. Around 46.7% of deaths were reported after the Pfizer-BioNTech vaccine. However, 53.3% of deaths occurred after Moderna immunization. More than 80% of reported deaths were adults over 60, with a median age of 76. Residents of long-term care facilities accounted for 18.3% of reported deaths. In 4,119 cases, death occurred 10 days following vaccination. The majority of deaths happened within a few days post-vaccination. In VAERS, researchers explored the influence vaccines may have on people's lives. This includes a week-long post-vaccination health survey.